And one of the worst companies actually is UnitedHealthcare in this respect. UnitedHealthcare is the largest health insurance company in the country. They are the largest employer of doctors and own thousands of pharmacies, clinics, surgery centers, and home health agencies, as well as hospice providers.
What happens when a lawmaker follows the money? And it leads straight to one of the largest corporations in American healthcare. In this tense exchange, Representative Alexandria Ocasio-Cortez confronts HHS Secretary Kennedy over massive taxpayer payments to for-profit insurance companies, even as reports point to fraud investigations and billions in alleged waste. What begins as a discussion about conflicts of interest quickly turns into a showdown over who really benefits from federal health programs and whether corporate power is quietly overriding accountability.
You talk a lot about corporate influence and corruption in government. And this is an area that's very important to me, and it's an area that I do a lot of work in. I am, as a public servant, completely financially divested of any conflicts of interest with any healthcare companies, any stocks, any lawsuits that I would financially benefit from. Are you?
Yes.
You're completely divested.
Yes.
You have no financial interest in any lawsuit, crypto, none of that.
No. Oh, okay. Crypto? I own Bitcoin.
Okay. And do you have any other securities or assets?
I don't. I mean, I had to go through this with the Office of Government Ethics, and I had a few interests that were very minor that I divested.
Okay, just checking. I'd always
it's a good question.
I always like to know what the field is before I enter conversations. So thank you for that. In the healthcare space, something that we've both spoken to is that some of the worst actors are in the for-profit medical space. Are in for-profit health insurance, big pharma, et cetera. And one of the worst companies actually is UnitedHealthcare in this respect. UnitedHealthcare is the largest health insurance company in the country. They are the largest employer of doctors and own thousands of pharmacies, clinics, surgery centers, and home health agencies, as well as hospice providers. Secretary Kennedy, are you aware that President Trump's Department of Justice is reportedly investigating UnitedHealthcare for criminal insurance fraud in some of their for-profit health insurance plans, like Medicare Advantage?
I'm not aware of that investigation.
You are not aware that the Trump Department of Justice is investigating the largest insurance company in America that...
No, I'm not aware of...
For fraud in Medicare Advantage?
No, I'm not aware of that.
That you have jurisdiction over?
It doesn't surprise me.
Okay. In your submitted testimony, you said HHS takes seriously our role as responsible stewards of taxpayer dollars. Are you aware that for-profit insurance corporations like UnitedHealthcare have been found to be defrauding public dollars of more than $80 billion a year?
I'm not aware of that number, but
You're
I'm
not
aware
aware
that
of
there's
that?
fraud across the for-profit sector.
Respectfully, Secretary Kennedy, if we're making decisions around waste, fraud, and abuse, this is the largest source of waste, fraud, and abuse of public dollars in the public insurance space.
You say $80 million?
$80 billion a year.
80, did you say 80 million or 80 billion?
80 with a B. Billion.
With a B.
Yeah. If that's the case, why did you nearly double the rate that taxpayer dollars give for-profit insurance companies like United next year if you don't know those things?
Double the rate? How did I do that?
So your agency nearly doubled the taxpayer dollars that for-profit insurance corporations like United will be paid next year, meaning these companies, the largest of whom is under investigation, criminal investigation by the Trump administration, will be receiving an additional $25 billion from your agency.
How is that happening?
I would be happy to submit to the congressional record evidence of this. I will enter the CMS press release from April 7th of 2025 into the record, which states that Medicare Advantage corporations will now receive a 5.06% increase in payments next year under your jurisdiction. Mr. Secretary.
Well,
This is
without-
up from 2.2%.
I mean, we're raising.
Without
was
objection.
proposed from the Biden administration. You are doubling the rate that the Biden
The gentle
that
lady's
these
time has
criminally
expired.
investigated companies.
The gentle lady's time has
receiving.
expired.
This exchange centers on a fundamental question about public trust and the stewardship of taxpayer dollars within the American healthcare system. Rather than relying on abstract claims, Representative Ocasio-Cortez directs the discussion toward concrete figures, identifiable corporations, and documented policy choices. By focusing on Medicare Advantage and the dominant role of large for-profit insurers, she forces attention onto a segment of the system that manages enormous public funds while operating under private profit incentives. A central focus of the exchange is UnitedHealthcare, one of the largest health insurance corporations in the United States. Ocasio-Cortez underscores reports of criminal investigations and widespread fraud associated with for-profit insurance programs, while also highlighting the company's massive footprint across doctors' practices, pharmacies, clinics, surgery centers, and home health services. This level of vertical integration concentrates power across multiple layers of care delivery, raising concerns about conflicts of interest and making meaningful oversight more complex and difficult to enforce. Rather than accepting broad assurances about responsible stewardship, Ocasio-Cortez presses for specificity. She introduces figures suggesting that tens of billions of public dollars may be lost annually to fraud and abuse within Medicare Advantage. These numbers reframe the issue. Waste and fraud are no longer isolated incidents or administrative inefficiencies. They appear as systemic risks tied to business models that reward aggressive billing, complex coding practices, and strategies that can exploit gaps in regulatory enforcement. The most consequential element of the exchange involves payment increases. Ocasio-Cortez points to official CMS data, indicating a significant boost in Medicare Advantage reimbursement rates. She argues that this effectively directs tens of billions of additional taxpayer dollars to the same for-profit corporations facing scrutiny for fraud and abuse. The implication is clear. Even in the presence of serious allegations and evidence of systemic vulnerabilities, financial rewards are expanding rather than contracting. This creates a credibility gap between stated commitments to protecting public funds and the policy outcomes that follow. When an agency asserts that it takes stewardship seriously, while simultaneously authorizing major increases in payments to corporations associated with large-scale fraud concerns, it raises questions about how priorities are truly being set. The issue extends beyond technical oversight failures and points toward incentive structures that may unintentionally reward behavior that undermines program integrity. The exchange also highlights how corporate influence can shape health policy outcomes. Large insurers possess extensive lobbying power, deep political relationships, and broad integration into the healthcare delivery system. When these same entities continue to receive expanded public funding, the line between public interest and corporate profit becomes increasingly blurred. The concern is not only about misconduct, but about whether policy design itself has become overly aligned with industry interests. Another significant dimension is transparency and institutional awareness. The Secretary's lack of familiarity with specific investigations and financial figures illustrates how even high-level officials may struggle to track the full scope of corporate conduct within massive federal programs. This knowledge gap weakens accountability. When oversight relies on incomplete or delayed information, structural problems can persist, allowing systemic abuse to continue without timely correction. The broader implication is not limited to one company or one payment adjustment. It speaks to whether federal health policy is structured to detect, deter, and correct large-scale abuse, or whether it continues to expand funding streams even when serious warning signs are present. This confrontation brings that tension into sharp focus and raises enduring questions about how public resources are managed in one of the most powerful and expensive sectors of the American economy.